Good morning, everyone. Welcome to the Partnership to Advance Tribal Health, PATH, Leadership Learning and Action Network, Culture of Safety, Part 1. Our speaker today is Dr. Ronald Wyatt. Dr. Ronald Wyatt is Chief Quality Officer at Cook County Health and Hospitals, one of the largest public health systems in the United States. Dr. Wyatt has over 30 years of experience as a clinician with extensive experience in promoting healthcare quality and patient safety at the system, institutional, and organizational level. He's practiced medicine in a variety of settings for over 2 decades, including the Department of Veterans Affairs, U.S. military, community health centers in Missouri and Alabama as a medical director, and in private practice. In 2012, Dr. Wyatt was appointed as the medical director in the Division of Healthcare Improvement at the Joint Commission. During this time, he also served as the Commission's representative on the National Coordinating Council for Medication Error Reporting and Prevention. In 2016, Dr. Wyatt was appointed as the first Patient Safety Officer for the Joint Commission, where he directed the Office of Quality and Patient Safety, established a Patient Safety Fellowship, and was a contributor to the Joint Commission Sentinel Event Alerts. He currently serves as co-chair of the IHI, Institute for Healthcare Improvement, Equity Advisory Group. He presents nationally and internationally on leadership, safety culture, human factors in healthcare, patient experience, and health equity. Dr. Wyatt, I will turn it over to you.
Great. Thank you very much, Ms. White, and good morning and welcome to all. It's really an honor and delight to be able to join you this morning, and we'll have another time together in the weeks ahead. First, some apologies if you hear noises. There's lots of construction going on right outside my window, and my office sits in the middle of 3 very busy emergency departments, so you might hear sirens from time to time. So we'll go through the presentation, and I hope we'll have a fun time together. Next slide, please. So a bit about Cook County Health and Hospital System. It's a busy place. We have over 1 million outpatient visits, over 20,000 hospital admissions. It's one of the busiest emergency departments in the country with the level 1 trauma center. There are 16 ambulatory community health centers that are scattered across the expanse of Cook County, Illinois. We also provide services for CIRMAC Health, and that is people who are incarcerated. And we also run a county managed Medicaid health plan. Next slide. A bit of background history about Cook County. It's where the pathology of sickle cell disease was first discovered back in the early 1900s. It's the site of the first standalone blood bank in the U.S., as the nation's first comprehensive trauma center, and also is the site of Chicago's first HIV/AIDS clinic. Next slide. John Stroger Hospital, where I'm located, is Joint Commission accredited. We just 2 weeks ago went through our reaccreditation process. It is a teaching hospital with over 400 residents and fellows, as well as over 300 attending physicians. Next slide. So today what we want to talk about are the basic components of a safety culture in an organization. What are the key contributors to a safety culture? How do we begin to assess safety culture and understand the role of leadership in a culture of safety? And really points 3 and 4 will be the keys to our next time together. Next slide. So let's start with with an operational definition of safety culture, and just talk about what culture is. And as you read through that, what it comes down to is the culture in an organization is how we behave, how we act, how we treat each other. What is our DNA? What do we tolerate in that organization? This includes how the system operates around errors, near misses, and then how do we prevent harm? Next slide. So this is the Joint Commission standard, and I won't say much about the Joint Commission, but I think this is another good place to start. And next slide, please. So you'll see that the Joint Commission's standard says that leaders create and maintain a culture of safety throughout the hospital. Next slide. And what builds on that then is that leaders should regularly evaluate the culture, prioritize and implement changes that are identified by that evaluation, and then provide resources and opportunities for the organization to become safer and to implement quality initiatives. Next slide. So this comes from the work of Edgar Schein, who is one of the foremost thought leaders in the world around organizational culture. And what he does is separates out culture into these categories. And at the top of that pyramid, you see our behaviors. And the desired behaviors are how we round to assess appropriateness of the care processes in our organizations. What do we believe? What are our values? And is one of those values how we work together in teams? And then underlying assumption is that safety is the core system property. And I want to emphasize that in an organizational culture, safety has to be the core system property. Next slide. So then as we look at the components of a safety culture, and this draws from the work of James Reason, who was an early pioneer in safety culture. And if we think through this, then we see that when we think about a safety culture, first, is it a reporting culture? That means inside the organization, are people who are in direct contact with risk and hazards, are they able to report what they see and find? Next is the culture, a just culture. Again, this was a term that was first introduced by James Reason, but some of the early work around just culture grew out of the nuclear industry, particularly after the accidents at Chernobyl and 3 Mile Island. And in a just culture, and we'll talk more about this, this is a culture where there's an atmosphere of trust, that people are encouraged inside that organization to trust each other, people are rewarded, and that there's a free flow of information inside the organization. Next is the organization flexible. And flexible gets back to that first term, is teaming or teamwork. And inside that kind of culture then, there's an adaptability and an adaptability. So an example of teamwork training is crew resource management or the Team Steps programs that are really robust ways to develop teaming and teamwork inside an organization. And then ultimately what we want to be is a learning organization where we take the information from the safety systems that we have and then have the will to implement change based on what we see in an organization. And it's most important here that the culture be informed in order for the culture to be a safety culture. At the top of that pyramid is how to become a high reliability organization. And to be clear, there are really at this point no high reliability organizations in healthcare, but many are on that path. Inside of a high reliability culture then is, again, safety. Is that organization preoccupied with failures? Is there a sensitivity to how the teams work and how the teams affect the process? And is there a culture that allows people that are closest to the processes can make decisions? And in the organization that is working on being a high reliability organization, that organization resists the temptation to blame people and individuals for errors. Next slide. So why does this matter? And from my work at the Joint Commission and other places, although there are some that would resist this slide in a way, I do believe that this is accurate, that the third leading cause of death in the U.S. Is directly or indirectly related to medical error. So that makes this really important and really makes it matter. Next slide. So then if we think about how we began to make an organization safer, part of this gets back to, are we a reporting and learning culture? So what we want to be able to do is mitigate risk. We want to identify what are those leading indicators of harm in an organization. So are we looking at unsafe conditions and near misses in order to make the organization safer? Are we trying to increase positive feelings and decrease negative impact of accidents and errors inside an organization? So inside a safety culture, what we want to look at is what are those pre-events? What are those signals that says that we are about to have an error or some type of safety event. Next is if there's a minor event, again, unsafe conditions, that we identify those, understand why it happened, and then how can that organization learn and spread that learning across the span of the organization and implement robust changes that will lead to decreased risk. Next slide. So then what are the fundamentals of a safety culture? I think number one and foremost is that organization and organizational leadership must declare that we want zero harm, zero preventable harm, zero preventable injury, and zero preventable death in the organization. We need to begin to measure harm. This could be a sentinel event rate, it could be a harm index, but start to measure over time what the harm is, where it is, and how we're approaching it to remove harm from the system. Leadership skills we'll talk more about next time, but this is also really crucial. I'll focus in on one aspect of leadership skills, and that is humility, which is emerging as a contemporary topic around strong leadership. Do we have humble leadership? And over my time, I've been involved with some really humble leaders, and a couple of them I'll name. One is Don Berwick, who I learned a lot from around how leaders can truly be humble. The other one, quite frankly, is part of your system. A good friend of mine, colleague, and that's Rear Admiral Ty Reedhead, who is one of the most humble leaders that I've ever worked with. Next, we talked about just culture. Are we doing safety huddles in the organization? And what are those universal skills that are needed in a safety culture that we list out there? And again, to get back to some of Edgar Schein's work, humble inquiry is really important. Showing empathy is really crucial as we begin to build towards a more reliable culture. Communication is critical when we look at sentinel events that come into the Joint Commission year after year after year. The top three root causes are communication, leadership, and teamwork that led to some sentinel event. And then have some type of safety coaching training program as best we can. We know we're all in resource constrained environments, but those safety experts that are in the organization should be reinforced and encouraged to continue to coach and teach down to the sharp ends of the organization. Next slide, please. So then as we begin to link culture together, safety culture and just culture, next slide. We'll focus a bit, the one before that, we'll focus a bit just on just culture for a few seconds. And here we're really talking about an atmosphere of trust in the organization where people are rewarded, where people are free to talk about what is happening in an organization, particularly as it relates to unprofessional behavior. Next slide. So then when we start to think through this, then how do we apply principles in an organization that are fair and just? How do we strike that balance? A balance that says we must learn from the patient safety errors and events that occur in every organization, and then how do we manage performance violations? So in that system then, in any system, we want to reports of errors and safety events to be reported. They need to go through some type of robust analysis. We want to identify root causes and move those into measurable corrective actions. Then we want to share that information out so that the entire organization learns, and therein lies the resilience in that organization. We want to show that we respond to errors and events and then apply some type of logic to how we assess and manage culpability in an organization. Next slide. So then as we think about just culture, safety culture, and high reliability, there are some recurring themes that we should begin to think about and focus on, as I've outlined here. Have a safety strategy that's emphasized, remaining mindful, making sure you have teamwork that's localized and the experts are helping make decisions. Put in redundancies and fail-safe mechanisms inside that system. Be proactive around what's happening in an organization and less reactive and less responsive in a retrospective way. And again, we talked about learning culture, and we'll talk more about how to measure safety in an organization. Next slide. So how do you get started? I think first we want to listen to the caregivers and understand what the driving and restraining forces are. The caregivers really have the answers and the solutions for the culture. Have a framework that it is easy and free and less stressful to report and to learn. Focus on systems as opposed to the individual. Establish collective mindfulness as a core principle for the organization. Next slide. So it matters because in the end, we want to be, again, a learning organization on the pathway to become a high reliability organization. That means we need to have uniform and system-related approaches to changing a situation instead of this ongoing, what's been called a whack-a-mole approach to culture. Next slide. So just by way of history then, as we focus a bit more on just culture, we grew out of the pre-1990s punitive culture where fear drove errors underground. That was decreased reporting, and I will say they're still underreporting. Then we moved to a blame-free culture. And here, we wanted to acknowledge that caregivers can make honest mistakes. Next slide. So the benefits then, as we approach now, the blame-free versus a blame-worthy culture is, again, emphasis on increased safety reporting, building trust in the organization, and then making sure that we have effective safety and operational management that has a safety strategy that's foundational inside the organization. Next slide. And then try to apply some logic when there is a safety event in an organization. And this is the one that I recommend. This is the one that we use here at Cook County, again, from the work of James Reasons. And as late as before this call, when we went through safety events here at Cook County, we applied this algorithm to some of the events. As it happens, the events that we talked about all fell in that gray area. And then that's where leaders make decisions about what approach to take if it falls in that gray area, whether that goes, for instance, down a disciplinary path or whether it goes through another path where there's more education, training, and systems improvement. But I would highly recommend that any system start to approach unsafe acts in some logical way. Next slide. So just culture in healthcare, how we began to get there, we talked about making sure that we emphasize learning and shared accountability, that we focus on the organization's safety values and look for risk in a proactive way. Remain thoughtful around what the behavioral choices are in the organization. We have managers that look at system design and how that can enhance worker performance, emphasizing accountability and focus on that accountability as it relates to outcomes, being proactive, and then what are the most important questions to look at following an error? Why did the error occur, and how can it be prevented in the future, not who did it? Next slide. So the three types of behaviors, again, coming from the work of James Reasons that are involved in errors. One is human error, which is the weakest link, at-risk behavior, where workers drift into unsafe behaviors, and then reckless behavior, where a worker, care team member may realize the possibility of harm, but proceed anyway. So these behaviors are ones that should be managed through some type of remedial or disciplinary action if it's recognized that it is in fact reckless behavior. Next slide. So if it's reckless or at risk or human error, then there are approaches, and this comes from the work of David Marks, on what do we do then? So next slide. So if it's human error, then we know that this can be either a slip, a lapse, or a mistake. Next slide. If it's an at-risk behavior, then that's a situation where the risk was not recognized or believed to be justified. Next slide. And then a behavioral choice that shows some type of negligence or conscious disregard or willful disregard, and the person then takes some unjustified risk. Next slide. So if it's human error, we console. If it's at-risk behavior, next slide, We coach. If it's reckless behavior, then that goes either through counseling, through discipline, which can go up to and include termination. Next slide. So we've mentioned trust several times. There's no such thing as a team where there's no trust. And I put this slide in here repeatedly to start to think about how we deal with unprofessional behavior in organizations, and how unprofessional behavior that goes unchecked, and if no one's held accountable, how that behavior can impact and impair the safety culture inside an organization. And I typically say when I put this slide up that every organization I've ever been associated with has what we think of as a Darth Vader. That person who is not held accountable. It could be a rainmaker in the organization. It could be a senior leader or an executive, or some person with some type of power that is on display on a regular basis. And the result of that person, a person is not being held accountable, means that they will damage the trust in the organization, because the workforce will decide, I'm not going to report this behavior or these acts because nothing's ever done about it. And then that becomes a unhealthy cycle of distrust in an organization. Next slide. So what we want to be able to do in a safety culture is to remove that power distance from a large distance to a small distance, from being an autocratic environment to one that's truly consultative and collaborative. And we want to, in a safety culture, the goal should be inside an organization, again, to reduce that distance between the groups in the organization. We believe that this will build trust. That trust leads to increased levels of learning and reporting, and really a more resilient and safer organization over time. Next slide. So a few minutes to talk about psychological safety, which is increasingly important in organizations, and it is how do we perceive the risk in an organization? Are we willing to take chances to speak up to coworkers, to superiors, or to subordinates inside that culture? And can we take that information into the organization and feel safe in doing so, knowing that what we report will lead to a safer organization? Next slide. So the psychological safety behaviors include transparency, again, that word teamwork, again, communication, just culture, respect. Now add in their dignity, and then receiving direct and timely feedback, as opposed to leaders saying, I'll get back with you on whatever it may be, and then that person goes away for weeks or months. Next slide. So in order to increase psychological safety, then what we want to do, again, is approach conflict in a collaborative fashion, not as an adversary. Speak human to human, anticipate reactions, and plan what those counter moves may be, particularly as it relates around addressing unprofessional behavior in an organization. We work then as leaders to replace blame with curiosity, try to get feedback on delivery, and then to measure psychological safety inside the organization. Next slide. So this comes from the work of Stephen Covey, as they talk about what's the hidden variable in an organization around culture. And we know that in an organization we have strategies. We want to execute the strategy to get the best outcomes we can for our patients and for our community and for our care teams. So that missing variable Stephen Covey talks about is the trust variable. Next slide. So when we then link trust and psychological safety, we build safer organizations. We build organizations that truly believe in the mission of zero harm in that organization, so that when you give information or you take the risk to give information, you know that that information won't be used against you in a retaliatory way, which we still see in healthcare, and it helps to build higher levels of psychological safety inside that organization. Next slide. Next slide. And next. So some practical matters then, and we practice these here in the Cook County system. We have a large safety huddle every morning, then leadership sessions every 2 weeks where we identify good catches, we look for trends, and we recognize team leaders who contributed to safety in the organization. We're building towards a safety champions program, building transparency in our processes. We're working from an organization perspective, policy driven, that a root cause analysis be done as soon as possible in the organization. And then we're applying the just culture algorithm, the James Reason's approach to blame-free versus blame-worthy. Next slide. So interventions from leadership is committing to safety, to model behaviors, to provide resources in the organization. Teach structured communication, whether that be crew resource management, SBAR, team steps, whatever that approach may be. We recommend having a methodology. And then to reduce that power distance, to reduce hierarchies, rank, et cetera, in the organization, and continue to work on behavior change, specifically working on how we address unprofessional behavior inside the organization. Next slide. So then in the end, what we've talked about is how we continue to improve a safety culture. And by doing so, we improve performance in the organization. It's a leadership imperative. It rests on building trust that results in increased reporting that leads to quality improvement initiatives that lead to measurable improvement in the organization, and we become a safer organization in the end. And I think that's my last slide. Thank you.
Thank you, Dr. Wyatt. This is Becky. I actually wanted to jump in because we had somebody in chat ask about what a good catch is, if you could define that for everyone.
So if I give a definition, a good catch is similar to a near miss. So an example would be if someone caught the wrong dose of a medication that's about to be given, but it hasn't touched the patient. So someone comes in and says, let's verify that dose, let's verify that route, or let's verify that that's the right patient. And if you find out that through a two-patient identifier, for example, that is not the right patient, then we consider that a good catch. So here at Cook County, we actually give an award, 2 awards that are good catch awards, and it's a trophy. And that person proudly displays the good catch award in their work site or unit until we have that next session, usually about 2 weeks apart. Hope that helps.
Great. Thank you, Dr. Wyatt. Thank you very much, everyone. And this is the breakout room questions that we used. And first up, I'd like to call on Carrie. I believe that you were helping facilitate the discussion in breakout room 1. So I'll turn it over to you to share what your team came up with.
All right. And actually, Lori, I think I'm going to put you on the spot. You've got our notes for our section. So just wondering if you can share a few highlights from our discussion.
Sure. So for the first question, what does it mean to have a reporting culture? We talked about if you see something, say something. We also talked about having accountability at all levels in order to report within the organization. Report as soon as possible, and making sure that all employees are able to report without blame. We also talked about mini safety advocates that have been implemented at some departments. We had a few examples. And did you want me to post everything from chat also?
Yeah, if you can.
Okay, so I'll do that too as we move into, let's see. How can an organization make a reporting culture part of a just and safe culture? Those are some of the other examples that we provided. We had quite a few examples in chat, and I'll just post those real quick.
I think one of the things we talked about with that too is measurement. So again, we talked about what we really want is an increase in the number of events reported. Not saying that we want an increase in adverse events or harm, obviously, but the more people are reporting near misses or risk areas or potential errors or harm, the better. Then we can't fix anything we don't know about. So we actually want to see the number of events coming through WebCident increase.
Dr. Wyatt, was there something that you wanted to share that was part of the discussion from breakout room 1?
Yeah, no, I think that captures the points and emphasize again, you want to see reporting increase. Over time, it does reach a plateau. but it should never start to drop off. And if it starts to drop off, and I've seen this in one large system, that was where leadership was actually suppressing reporting. So we want to make sure if the reporting takes a accelerated decrease, you want to understand why that's happening. Otherwise, you want to see increased reporting, and you want to continue a drumbeat around reporting and learning from it. And it's important that what you see in the system, you learn and then disseminate that learning out to the rest of the organization, because often what we hear is, well, we keep reporting, but we never see anything happen. So leadership has to have the accountability to make visible the improvements that result from that reporting. And again, emphasis on reward, celebration, acknowledgement for reporting, whatever it may be. It doesn't take much. You know, here we give the Best Catch Awards, and it brings a sense of pride to an entire unit that trophy is sitting in their unit. I'll stop there.
And Dr. Wyatt, we do have a question in chat from White River about how Cook County Health System is able to do timely debriefs with staff when a near miss or event happens during a busy patient care unit.
Yeah. So I'll take example of the busiest unit, and that is the emergency department. One of the busiest emergency departments in the country. And there they have active huddles throughout the day. They have really strong, accountable, visible, activated, and I say activated because that's a step beyond engaged. So that, and they have residents, they have students, they have fellows, they have even Navy fellows that come here for trauma training. So they have, you know, ongoing huddles in each unit all throughout the day. Pharmacy gets involved, and when something is posing a risk in the system, it could be a broken piece of equipment. They're pointing it out and trying to get it addressed in as rapidly as possible as we possibly can.
Great,
and I would say I use the emergency department because if they can take the time to do that in the emergency department in Cook County in Chicago, you can do that on a nursing unit.
Exactly. We're going to move on to breakout room 2 because we have a few minutes left in the session. And I think that we have Kayla that was facilitating there. Can I call on you to tell us what your breakout room shared?
Yes, absolutely. So for the first question, how is reporting a part of a just and safe culture? We talked about how you don't know what you don't know. So you need to make sure that you can get as much information as possible. You don't know what you need to work on if you don't know what's wrong. So somebody mentioned that their organizations are so large and leadership can't be everywhere, so they need to rely on their staff to find those near misses and safety concerns. We also, what is the link between trust and reporting? We talked about people have to know something is going on to in order to report. It's really discouraging when you know there's an issue and you let leadership know and you don't feel that anything is actually being done about it. Building that trust, make sure there's no retaliation. Also freedom to report upline. So you might feel comfortable reporting within your department if you're in nursing, but you really want to make sure that they're comfortable as that issue is brought to other departments, since they will know who's reporting it. You want to make sure that everyone feels safe as it goes to everyone within the organization. And you need to focus on what was being reported, not who was reporting it, where that's, currently seems to be the focus in some places. And then in what ways can an organization encourage reporting of safe events? And it was talked about how it needs to be incorporated into the new employee orientation. It needs to start from the beginning, and it needs to be talked about daily at morning huddles and also within newsletters, as an example.
Thank you very much.
Yeah.
Dr. Wyatt, did you have a comment for some of the items that were discussed in breakout room 2?
I kind of came in on the end of that, but it gets back to what is the impact of reporting and emphasize just the direct link between reporting and trust. The crucial item there is when events are reported, that improvement begins to take place, that leaders make it visible, that's again communicated back out to the system, that the areas of concern are being addressed, and there typically becomes some theme, and we'll talk about that in measuring a culture, whether it's broken equipment or unprofessional behavior. Usually if an organization's leadership is looking at those reports, then they can go directly to where that activity is taking place. And again, put learning in place, show the system that you're accountable, show the system that you want to do something about it, you want to resource it, you want to provide training, whatever it may be. And then let the organization know that you've implemented that change. It's not enough just to know, you have to implement, and the organization has to see it. Someone mentioned they put it out in a newsletter. So some type of regular communication really becomes crucial to build trust from the reporting, and congratulate the organization for the reports. Say to the organization, we want more reporting from you. We want reports from every level in the organization, whether it be from nursing, physicians, trainees, environmental services, the facilities engineers. Everyone has to collaborate and report safety events in the organization wherever they see them. So brief example, we went to a medical staff leadership meeting yesterday evening. Once we got there, a physician said, well, we couldn't go through a particular door because the electronic entrance didn't work. So the chief medical officer said, well, did anybody report that? It was over 40 physicians. No one reported it because everyone thought someone else would report it, right? So something as simple as a fire door not working is a risk. So we have to always remind people, report what you see. Don't assume that someone else will report it, therefore you don't have to. And I'll stop there.
Thank you so much, Dr. White. That's a really good example of the door not working and people not reporting it. We're at the conclusion of our time today. I want to thank everyone for their participation, and especially Dr. Wyatt for his great presentation and comments in the chat, in the breakout rooms. We do want to hear from you, from all of you participants. If you have other thoughts or comments, please respond by using the chat or email us directly or talk to your path partner. We encourage you to join us for next month for part 2 of Culture of Safety to continue this discussion with Dr. White. He'll be back with us again. Again, thank you very much, and hopefully we will see everyone back here next month. It's October 10th, and have a great day. Thank you very much for participating.